So this is a 58-year-old woman with multiple surgeries in the past because she feels like after her surgeries, she looks unnatural and she couldn't quite place exactly what it is that bothered her, but she just wanted to look softer and younger. So what we decided to do was first address the eyes because it's really at that area she doesn't look natural. Because it's not a typical sort of Asian type of an eyes. And if we kind of break down how her upper eyelid actually looks, first off, her double eyelid fold is obviously too thick. Some patients feel like if I have bigger double eyelid, then my eyes look actually bigger. But sometimes when you make that double eyelid too thick, it actually makes your eyes look heavy and more hollow. What we decided to do with her was to bring down the double eyelid size and make it a little bit narrower. The other thing that we decided to do was to create sort of more of an almond shape. And what we mean by that is, if we take a look at her preoperative photo, the end of her eyes look a little bit down. But if we kind of raise up the end of her eyes, she looks actually more oval shaped. And that's more consistent with a natural and Asian eyelid. One more thing about her is that right above her double eyelid preoperatively, it looks hollow, right? I mean, that area looks kind of sunken in. So what we decided to do with her was we decided to put some fat in the upper eyelid itself. We took an eye that didn't quite kind of fit in with who she is into a much more softer, much more feminine and youthful upper eyelid. The other thing with her is that if we take a look at her face in general, she's got the typical signs of aging, which means that there is some sagginess with what we call jowls, the heaviness on the lower part of the face. We decided to perform a mini facelift, our version, which is we call wave lift. And that is through a minimal incision on the top part of the face using an endoscope, which means a camera. We decided to actually do a lifting for the lower part of the face. And then in conjunction with that, we decided to actually put some fat in the anterior portion of the cheek.